Welcome back, everyone. Your questions are coming in, so let's get straight to our live Skype with conversation with New Hampshire State epidemiologist Dr. Benjamin Chan. Here's our first question from Alan saying, do you think every person in New Hampshire will have to be tested before we think we have defeated this virus?
Good question, Alan. And I think that the short answer is that no, not everybody needs to be tested. Certainly, we want anybody who has symptoms of COVID-19 to be tested. And in fact, we're going out and testing some certain people who don't have symptoms if they're associated with, for example, an outbreak at a long-term care facility. But in general, not everybody needs to be tested in order to control this outbreak. Right now, what has brought the outbreak under control are our social distancing measures. We still encourage and want people to practice those social distancing measures, but we are ramping up testing so that we can more rapidly identify infection and try and contain this. That's going to focus on, trying to test more broadly people who have symptoms of COVID-19, even if they're only mild symptoms.
Kate wants to know, how long do you see this staying in New Hampshire? Do you think the stay-at-home order will go beyond the end of May?
So I think there's going to be need for some type of social distancing into the foreseeable future. So I think how society functions and what things look like months from now is going to look very different from before there was a COVID-19 outbreak. I think what people can expect to see is that COVID-19 will be with us for many more weeks, if not months. How long COVID-19 is with us, I think still remains to be seen. But as we relax some of the stay-at-home measures that have been put into place, I think people can expect to see a gradual and incremental reopening and relaxation of some of these measures. But people for right now especially should still be social distancing. They should still be staying home as much as possible, staying at least 6 feet from other people. And we do recommend that when people are out in public places that they're practicing good hand hygiene and using a cloth face covering when in public places.
Dr. Chan says keep it up. Mike asks, has the May 4th expansion of hospital procedures been effective enough to show promise in the gradual reopening?
So Mike is correct that we are starting to work with hospitals and other healthcare entities and dentists, for example, to begin to open some of these essential functions so that people can get the healthcare that they need. We are going to continue to follow the data in New Hampshire in terms of data looking at the spread of COVID-19 in our communities, but it's going to be probably 2 to 3 weeks before we would expect to see any change in these numbers if our interventions and changes over the last week are going to have any impact or effect on the spread of COVID-19.
All right, we'll be watching those numbers. Benson asks, should you be tested for the virus or antibodies if you've never had any symptoms or had known contact with anyone who has?
Yeah, so we're not recommending widespread testing of everybody right now. Certainly if someone does not have symptoms and they're not known to have come into contact with someone with COVID-19, we're not recommending that they be tested for COVID-19. Certainly if someone develops symptoms, even mild symptoms of COVID-19, they should be talking to their primary care provider about testing. We want to be able to expand testing to people with even mild symptoms. But one of the key ways we're going to continue to control the spread of this virus and prevent it from spreading are the social distancing measures that still remain in place.
All right, Dr. Chan, thank you so much for answering so many of our viewer questions. And you thought those questions were tough? You ain't seen nothing yet. This Monday at 7 p.m., tune in for a very special New Hampshire Chronicle where kids get the chance to ask Dr. Chan their questions about COVID-19.